ሰላም የሊሻን ቲዩብ ቤተሰቦች ዛሬ በአዲስ ቪዲዮ መጥቻለሁ። ፓርት 2 በኤስሲ ነርሲንግ ኤግዚት ኤንድ ሲኦሲ ቤዝድ ሪቪው መልቲፕል ኩዌስችን ይህንን ሪቪው ሆነ መልቲፕል ኩዌስችን ያዘጋጀላችሁ ሊሻን ሄልዝ ቲዩብ ነው። እንደተለመደው ሁላችሁም አምስት ጊዜ ኮፒ ሊንክ፣ ሼር፣ ሰብስክራይብ ያደርጋችሁ ለብዙ ሰዎች አድርሱ። ጥያቄዎቹን እየሰራችሁ ራሳችሁን ለኤግዚት እና ሲኦሲ ፕሪፔር አድርጉ። Question number 10. Which a client is risk for the development of sodium level at 130 milliequivalent per liter or 130 millimole per liter? A. The client who is taking diuretic. B. The client who is hyperaldosteronism. C. The client with Cushing syndrome. D. The client who is taking corticosteroid. So the correct answer for question number 10 is A. The client who is taking diuretic. Question number 11. The nurse is caring for the client with heart failure who are receiving high dose of diuretic. On assessment, the nurse notes that the client has flat neck vein, generalized muscle weakness, and diminished deep tendon reflex. The nurse are suspect hypernatremia. Which or what additional sign would the nurse are expect to note in the client with hypernatremia? A. Muscle twisting. B. Decreased urinary output. C. Hyperactive bowel sound. D. Increased specific gravity of urine. The correct answer for question number 11 is C. Hyperactive bowel sound. Question number 12. The nurse review a client laboratory report and the note the client serum phosphorus or phosphate level is 1.8 milligram per deciliter or 0.45 millimole per liter. Which condition most likely cause this serum phosphorus level? A. Malnutrition. B. Renal insufficiency. C. Hyperparathyroidism. D. Tumor lysis syndrome. The correct answer for question number 12 is A. Malnutrition.
COC covers all treatment for men, women and children including cancer, IVF fertility, cardiac, joint and hip replacement, oncology, neural. Have our offices in Dubai, India, Turkey and Ethiopia.
Number 30. The nurse is reading the healthcare provider progress note in the client record and read that the healthcare professional has documented insensible fluid loss of approximately 800 ml daily. The nurse make a notation that our insensible fluid loss occurs through which type of excretion? A. Urinary output. B. Wound drainage. C. Integumentary output. D. The gastrointestinal tract. The correct answer for question number 13 is C. Integumentary output. Question number 14. The nurse is assigned to care for a group of clients. On review of the client medical record, the nurse determine that which client is the most likely at risk for fluid volume deficit. A. A client with ileostomy. B. A client with heart failure. C. A client on long-term corticosteroid therapy. D. A client receiving frequent wound irrigation. For this question, the correct answer for question number 14 is A. A client with an ileostomy. Question number 15. The nurse is caring for the client who has been receiving intravenous diuretic. Suspect that the client is experiencing a fluid volume deficit. Which assessment finding would the nurse notice the client with this condition? A. Weight loss and poor skin turgor. B. Lung congestion and increased heart rate or tachycardia. C. Decrease hematocrit and increase urine output. D. Increase respiration or tachypnea and increase blood pressure or hypertension. So the correct answer for question number 15 is A. Weight loss and poor skin turgor. Question number 16. On review of the client medical record, the nurse determined that which client is the risk of fluid volume excess. A. The client taking diuretic and has tinting of the skin. B. The client with an ileostomy from the recent abdominal surgery. C. The client who require intermittent gastrointestinal suctioning. D. The client with kidney disease and a 12-year of history of diabetic mellitus. So the correct answer for question number 16 is D. The client with kidney disease and 12-year history of diabetic mellitus.